So I'm excited to introduce Amanda, who is my dear friend and an amazing therapist here in Park City. She owns her own private practice, and tonight she's going to be talking about EMDR for different trauma related to birth, pregnancy, postpartum. And yeah, I would say as someone who semi-recently gave birth, I'm certainly interested because I think a lot of aspects of it are traumatizing that a lot of us new moms don't even realize until we really talk about it. So we're really grateful to have you, Amanda, and I'll let you take it away.
All right. Thank you so much. And thank you, Sarah. And thank you, Perry, for having me today. I'm super excited. As Kayla said, my name is Amanda Hough. I am a licensed clinical social worker. I have a small private practice in Park City. I offer hybrid, so I do some remote, and then I have a really cute little office in Jeremy Ranch that I love. So I guess just a little bit about me and my practice. I started doing therapy in 2015. I started working actually with adult male offenders. And then through that population, I started working with teenagers with the diagnosis of borderline personality disorder, doing a type of therapy called DBT, dialectical behavior therapy. Through that, I started working with oddly enough, some priests and nuns. So I worked with the Catholic Church and doing some DBT for some personality disorders. And through DBT, a big part of it, a through line of that therapy is figuring out, what is a life worth living? What does that mean for you? And during that work, I started to really think about, what does that mean for me? What does a life worth living look like? And then I realized it did not look like Philadelphia, which is where I was living. It looked like the mountains. So in 2019, I moved out here. In 2020, I started my own practice when we all were remote, and frankly, there was no overhead. And I've been doing my own practice ever since. What I focus on mostly is trauma. So the two major types of trauma therapies that I do are EMDR, which is what I'm going to talk about today, and then another type of therapy called IFS, which is internal family systems, which I could talk to you all about for hours and hours. And I do that with Kayla quite often. So I won't get into that now because I don't want to take up that time. But if you have any questions about that, please feel free to ask at the end, or even I can share my information and you can shoot me an email or a text. So for now, we're just going to start with, I'm going to see if I can do the technology part of all this. Oh, I did it. Okay. Excellent. So for on the sake of my own tendency to get distracted, I'm going to close the little Zoom boxes. If you have any questions or you need to stop me, please just say something, because I won't be able to see you if you raise your hand or something. But please interrupt me whenever if you have a question or you need me to clarify anything. Also, I'm from the East Coast, so I tend to speak a little bit faster. So if you need me to slow down, do not hesitate to ask. Okay, I'm closing all of your beautiful faces now. Okay. So tonight we're going to talk about EMDR for postpartum PTSD. So I would imagine as moms, you guys are all very much familiar with the concept of postpartum depression. That is something that, while I don't think it's talked about enough in the mental health world, especially with new moms, it's talked about enough that it's a known experience, right? People are familiar with postpartum depression, but I think what's really not talked about is postpartum PTSD, which is postpartum post-traumatic stress disorder. It is not a diagnosis per se, it's a subset of the diagnosis of PTSD. And so we're going to talk about what that looks like, how postpartum PTSD is different from postpartum depression. We're going to talk about what EMDR is, and then how the two work really well together, how EMDR is a really effective treatment for postpartum PTSD. Oh no, hold the phone. Oh, there we go. Okay, so we're going to talk about, like I just said, kind of the differences between the two, risk factors. So everyone is anyone could suffer from postpartum PTSD if you've had a child or are pregnant. However, there are specific risk factors that I like to outline that kind of make it more likely that you would develop it compared to someone else, maybe someone else in your cohort. And then at the very end, we're going to do something called a resource installation, which I'm really excited about. So that is a more participatory part of this presentation. You guys are going to get to practice one of the skills that I teach my clients, which is all about kind of installing a safe, calm place in your body and in your mind. So we'll get to that at the end, and then we'll just do any questions you guys have. Okay. So let's differentiate postpartum depression from postpartum PTSD. So really, a lot of these symptoms are going to be similar to just typical major depressive disorder and PTSD, but this is all within the context of someone who is pregnant or has recently had a child. So when we look at postpartum depression, we look at depression either happening during pregnancy or after the birth. It can look a lot like the quote unquote baby blues, which is a really typical reaction that a lot of new moms have after giving birth, because hormones and there's a chemical imbalance, right? Everything's kind of out of whack, right? But the difference is with postpartum depression, it goes on longer and it's with a greater intensity. So baby blues, that typically happens for the first couple weeks after birth. Postpartum depression will go weeks and months. Some of these symptoms that we want to look for include a depressed mood or severe mood swings, severe anxiety or panic attacks, bouts of crying, difficulty bonding with your baby, negative feelings about yourself as a mother or as a person and your abilities to care for a child, disturbances in appetite, which could look like being insatiable, so eating too much or really having a difficult time eating at all, disturbances in sleep, sleeping too much, not getting enough sleep, feelings of hopelessness, thoughts of harming yourself or your baby, or recurring thoughts of death or suicide. And all of these symptoms, any of the symptoms you experience, have to really be interfering with your ability to care for yourself and or care for your child. So any one of these alone, a lot of us experience these. There will be moments where sleep is more difficult. There will be moments where eating is more challenging, where you feel like you're kind of eating everything in sight. There will be moments where you're really questioning yourself and your capabilities. All of those things are totally normal in and of themselves. But when they're clustered together with a high intensity and they don't seem to be dissipating, that's when we may want to look to postpartum depression. In terms of treatment, I'm not going to go into that into detail, but I would say kind of effective approaches for PTSD or for postpartum depression would be to talk with your primary care physician, talk to a therapist, and maybe even consider medication to help with those imbalances. In terms of postpartum PTSD, we want to look for, this can often happen when there is a difficult event that it happens either during the pregnancy or during the birth that results in trauma symptoms. These trauma symptoms can appear either immediately after, within weeks of the event occurring, or even for some people, things can feel totally fine. And then when they have subsequent children, these things can then be triggered. So it can feel like it's coming out of the blue, but really when we look at trauma symptoms, there is something in the neural network that's getting triggered. There is some familiarity, there is some association getting triggered. So it doesn't work on a specific time frame. It can kind of happen whenever, but when it does happen, it is exceptionally overwhelming. So these symptoms include avoidance of people, places, or situations associated with the trauma. So that could be, if you have a doctor's appointment, if the trauma occurred in the hospital, not wanting to go to that hospital, not wanting to be alone with doctors. It could look like, not wanting anyone to touch your body if you were handled kind of inappropriately or in an aggressive manner by anyone in the room when you were giving birth. It could be even, avoiding a crying baby if that sound is associated with the trauma. Difficulty sleeping again. So with the sleeping and eating, similar to that of depression, either sleeping too much or sleeping too little, eating too much, eating too little. And then hypervigilance. This is a really important and prominent part of PTSD. So what we know about trauma, whether it's like a big T trauma, which is a life or death situation, or a lowercase t trauma, which typically harkens back to early childhood, kind of perpetual neglect or any consistent theme in your life that really kind of denigrates how you view yourself or your position in the world. Trauma lives in our body. So when something is traumatic to us, when we can't fully process what happened appropriately and then store it into our long-term memory, instead, it kind of gets stuck in EMDR. We say it gets stuck in your mind, heart, and body. So it gets stuck in your mind. That's kind of these images that come up. It gets stuck in your heart. So that's the depression or the anxiety, the emotions that go with the trauma. And it gets caught in your body, which is your limbic system, which is where you experience emotions, where you experience trauma. So when we have trauma in our limbic system, typically our nervous system, our sympathetic nervous system, that's our fight, flight, freeze response, is activated at all times. Because we are constantly, we have a head on a swivel, we are ready for the next thing to happen. So it's kind of like a car with the engine always running. We are always ready for the next threat to hit us. We are always ready for the next life or death situation to come around the corner. So we become very hyper vigilant, always ready for something bad to happen, right? For something harmful to happen to us. So if we're feeling kind of paranoid or feeling like we're always agitated or jumpy, that could be hypervigilance related to trauma. We have increased anxiety or panic attacks. There's a re-experiencing of the trauma. So this looks like flashbacks, which is more intense than just a memory of a traumatic situation. It is a re-experiencing of the situation. So you're not just thinking about, oh God, that awful thing that happened. You are back there in the room with that awful thing happening to you. So it's a really pervasive experience. So flashbacks, nightmares, intrusive thoughts about the trauma. So thoughts that pop up in our head that we can't control, that cause us a lot of disturbance, and then a worsening of depression. And again, similar to the postpartum depression, these symptoms are really notable when they affect our ability to take care of ourselves. They affect our ability to take care of our children, and they affect our ability to participate in life. Okay, so I know that's a lot of information I just threw at you guys. Any questions about kind of the difference between postpartum depression and postpartum PTSD? Okay. So some of the risk factors for postpartum PTSD, this doesn't include all of them. This is just kind of some of the big ones, would be any real or perceived birth trauma. So we refer to this as a person-centered diagnosis. I think this is really important because the idea here is if something is traumatic to you, it's trauma. No one's going to argue. It's not, you don't have to fit a certain bullet point list of criteria for it to be trauma. If it is traumatic, if it affects the way you view yourself, you view your sense of safety, or you view your sense of vitality in the world, it is trauma, right? So if you experience anything that you would identify as traumatic, medical complications during birth or any unplanned procedures, that can be really traumatic, either on you, your body, or the body of your infant. Feeling powerless or not in control. So during the birthing process, I certainly don't need to tell any of you this, there is a lot going on around you, and it's not uncommon for a lot of chaos to be going on around you and no one talking to you. There's a lot of talking about you. There's a lot of talking about really vulnerable things having to do with you. And a lot of people have the experience of feeling like there's so much going on and none of it's within their control and no one is including them in it. That can be really traumatic for some people, especially if they have a history of trauma. Lack of support or reassurance can be exceptionally traumatic. So let's say, you don't have your support system with you. They're stuck in traffic, or they happen to be out of town and, your birth is starting, or you have doctors or nurses who don't have terrific bedside manner and you don't feel comforted while things are happening, whether things are happening according to plan in terms of the actual birth, or there are complications and you're not getting a lot of comfort or reassurance. That can feel really isolating and pretty scary. As I said, unplanned procedures, and then history of trauma in mom's life before the birth and history of mental health challenges in mom. Some other things that aren't on this list, or I think a really big one, is I think past, if you've had miscarriages, if you've had abortions in the past or an abortion in the past, a lot of that can bring up, can lead to some pretty traumatic experiences during the birthing process. And then we think of kind of situations that can happen after birth, right? So the trauma doesn't, the risk of trauma doesn't stop once the birth occurs. Now suddenly you're in charge of this little nugget, and a lot of trauma can come from that too, whether it's tapping into past trauma you experienced with your parents, whether it's tapping into the fear, the overwhelm of taking care of this child while your body is healing. Not to mention different things that can happen to your body as you heal, right? That process can be really traumatic. If you have any issues with pelvic floor healing, if you have any issues with any other types of healing in your body, if that's not going well, moms are often kind of told implicitly or explicitly to put their own pain aside and show up. And that in and of itself can be really traumatic. So lots of different risk factors for postpartum PTSD. Okay. An estimated 3 to 15% of women suffer from postpartum PTSD. That's a pretty wide gap, 3 to 15%. From what I've read, it seems like that gap really is because there isn't a lot of research done on postpartum PTSD. You might all be shocked to hear that in the medical field and in the mental health field, women aren't studied that much. So we're kind of seen as these like mythical creatures who like cannot be studied or analyzed. But there's more studies, there's more research going on about this. But as of right now, this is kind of what's estimated, 3 to 15%, which still, I mean, up to 15%, that's a pretty prevalent diagnosis. And again, just not something that's talked about, certainly not something that I think a lot of women get education on beforehand. Okay, so we're going to put the postpartum PTSD on the shelf for right now, and we're just going to focus on what is EMDR. EMDR is becoming a pretty popular form of therapy right now. It was created in the 70s or 80s by Francine Shapiro. So we love any therapy that's created by a woman. And it stands for eye movement, desensitization, and reprocessing. It is an extremely evidence-based form of trauma therapy, meaning they have done a ton of research, and the research really shows that it is effective for memory-based traumas. So the reason why you wouldn't necessarily get EMDR therapy for postpartum depression is because your postpartum depression is not necessarily based in an explicit memory that was traumatic, right? So EMDR is great for trauma that is connected to specific experiences in your life, specific trauma memories. And we do this through something called bilateral stimulation. So bilateral stimulation, BLS, this is where the eye movement comes in. So if you look at the image on the right, you see a woman kind of waving, you can't see, she's waving her finger, and there is someone watching, okay? So we use bilateral stimulation, which is kind of moving your fingers from right to left and track. So you as the patient would track your eyes right to left and follow the fingers. That type of stimulation helps our brain access trauma memories, access the memory both cognitively, emotionally, and physically, right? So there's that limbic system, the emotions and the beliefs. It helps open up the trauma memory, and then it allows you to reprocess the memory, think through the memory, work through the memory, so that your brain can effectively store it in the long term. Because remember I said with trauma, it's very much alive and active. So I could be 33, but I could, when I'm in my trauma state, I could be, 5 years old reliving the trauma I had as a child. My kid could be, 6 months old and everyone is safe and my child is healthy. But if I have to go back to that hospital where I experienced whatever trauma I had, I am right back in there. My body, my brain, it's like I never left that room. So BLS, there's some, and I'll be honest, we don't know why it works. There are certainly some theories, but none of them have been proven to be true or not. We know it helps calm down the amygdala, which is where fear lives. But other than that, it's kind of like people kind of make up their own reasons. but we know it works. So there's something about this movement, there's something about bilateral stimulation, turning on both sides of the brain, that really helps bring up trauma memories, process them effectively, and then store them so they're not so intense and they're not triggers anymore. Okay, so when we talk about kind of what EMDR looks like, I really like to use the image of a weed. So think of your symptoms, whatever symptoms someone might be experiencing, someone who has experienced a trauma. Those symptoms are the flower of the weed. So let's say the symptoms are, I get really agitated every time my baby cries. I get panicky and I want to throw things across the room, possibly at my husband, right? Those would be the symptoms. Sometimes it's valid, but sometimes those are just, those are unhelpful symptoms. So if we just did therapy and I taught you skills on how to breathe and regulate your anger and step out of the room every time your baby cries and, put something cold on your face, right? That would be like chopping the head off of a weed. It's an effective way to take care of things in the moment. But what happens when we chop the head off a weed is that the weed grows back, right? So often people feel overwhelmed by how often they have to use these skills to calm themselves down. And then a few hours later, they get re-triggered. And then the next day they get re-triggered. The next day they get re-triggered. And that's because there's a whole root system beneath the head of the weed that's fueling it, that's causing it to grow back. And that's how trauma works. If we just focus on the symptoms you're experiencing today, it's not going to go away. You're going to continuously get triggered. And living a life where you're just constantly coping is really not a very fulfilling life. So EMDR is all about, okay, let's look at your symptoms right now. Focus on the event that triggers these symptoms. What's the negative belief you hold about yourself? I am bad. I'm not safe. It's my fault, whatever that might be. And we do what's called a float back, which is we allow you to float back in time and identify what are the other memories that felt like this. And we go back and back and back as early as you can until we identify what's called the touchstone memory. That's the seed that was planted from which this weed grew. So if we can go all the way back in time, and maybe sometimes it doesn't even feel related. I remember when I was 3 years old, I needed my diaper changed and no one came for me for 6 hours. I was left alone and I didn't think anyone would come help me, right? It could feel like that's a completely unrelated memory, but there is something about that initial experience that planted this seed that you are not worthy of love. You are not good enough. It is your fault, whatever that negative belief is. And then later in life, you experience other events that further confirm that belief about yourself. And then you have the birth trauma, and that might just solidify it. It's being fueled by that original belief, and then it's continuing it. There are some people who have what's called single incident trauma, which means you do the float back, there's nothing there, and then we say, great, we start with the one trauma. We start with the birthing trauma. But I would say more often than not, there are other memories in there. There's a whole root system. So how does EMDR work? First, we do the float back technique. Then we reprocess all past memories. We go through each memory using the bilateral stimulation until there is a disturbance of 0. I feel there's no disturbance here. It doesn't upset me. I don't feel anxious. And then best case scenario, that negative belief I talked about is actually replaced with something more positive. We go through each of the past memories. Then once that's all cleared, we start with, okay, what are the present triggers? Okay, your baby cries and that still agitates you. Let's identify the triggers currently happening in your life, and we reprocess those. And then once all present moment triggers are gone and there's a disturbance of 0, then we plan ahead for future situations. Okay, you have to go back to the hospital to get a 6-month checkup. What do you need? How can you feel empowered, right? And then we work on kind of reprocessing those future-oriented fears and installing more empowerment. Okay, so it's a 3-pronged approach. It can be a lengthy process. It is certainly a difficult process, but it's a comprehensive process. We want to make sure we're not just chopping off the head of the weed so that when you have the next child, or you have to be in a supermarket with a crying baby, or you have to go back to the hospital or whatever, you can live your life without experiencing those PTSD symptoms of being hypervigilant, being anxious and panicky, avoiding things that could really add to your life. Okay. So I'm going to stop here. Any thoughts or any questions about EMDR and how it can be applied to postpartum PTSD? Yeah, Sarah.
I have a question. This is also interesting. Thank you so much.
Oh, good.
So do clients take the technique off, or not, out of the office? Like if they're in the supermarket and they're having an instance, are they doing the EDMR, or is that something that is done in the office to help process?
Yeah, thank you for asking that, because that actually brings us to the next part. So yes and no. So EMDR, when we're doing the bilateral stimulation in the room, I'm having you think of a specific memory. What's the negative belief you hold about yourself? Where do you feel that in your body? There's a very specific protocol. And then we do fast BLS, right? So we're kind of waking up the memory and activating it. We're very activated in the session. That is not something I would encourage people to do outside of the room. What I do encourage clients to do outside of the room is to use slow bilateral stimulation, and we do that in the form of tapping. So fast wakes up trauma memories. So I don't think you want to be waking up trauma memories when you're out in the world. Slow, so you can't kind of do it to yourself. So we use tapping. Slow tapping actually helps people slow down and relax. So we do something called resource installation. So my first point here, build up resources. In resource installation is installing skills that can help, installing places, installing protective people, installing imagery, whatever works for you. Installing this in your mind and in your body so that when you go there, when you bring up your safe, calm place, you can feel your body relaxing, you can feel your mind relaxing, and we do that with tapping. So tapping is something we encourage people to do on their own. The fast BLS is not something we encourage people to do. Okay.
Amanda, I have a question.
Yeah, shoot.
I don't think I realized how long of a process this could take in terms of going back to anything that could have affected your personal life. So this is personal, but let's say I want to have another kid, but I feel like I have some fears because of how my first pregnancy went.
Mm-hmm.
How do we go about starting that process then?
For sure. Yeah. So you would talk about okay, tell me about the fear that you're having. Okay. And when you think of that fear, what's the image that comes to mind that represents that fear to you? Whether it's a recent memory. So it could be I was talking to my mom and she brought up having a second kid and I totally freaked out, right? Okay. So now you focus on that memory and you play it in your mind. If you were playing it like a movie, where would you pause it to say, that's the image that I felt the most distressed? And maybe it could be oh, the look on my mom's face at how excited she was at the thought, or it could be, looking down at my hands and seeing how white knuckled I was getting through that conversation. It could be just looking over at my son and seeing his little face. There's whatever has the most intensity to it. And then you say, okay, focus on that image. And what's the negative belief you hold about yourself? Now, a negative belief doesn't have to be self-critical. It can be, but sometimes a negative belief is just, it could be, I can't do this, or I won't survive again, or I won't be able to handle it, whatever it is, or I'm not safe. And then that is where you say, okay, focus on that, focus on where you feel that in your body. And now just let your mind float back and just be curious to see, are there any memories that come up that feel similar to this? And that's how you do the float back. And it's always very interesting to see when people say I don't think so. And then I'm yeah, give it a shot. And then some of the memories that come up are oh my God, I didn't even remember that I can't believe I thought of this. I was in second grade and I had a lunch box that someone made fun of. It can seem so odd, but there's normally a whole system there that's feeding it.
Okay, that visual makes a lot of sense. Thank you.
Yeah. So it's all about connecting it to memories and your limbic system. Okay. Any other questions?
I have one more question. How did they figure
Great.
out that this worked? Like, I know you said you don't know why it worked, but like, did
Yeah.
someone, were they like experimenting, or do you have any, I'm
Yeah.
a little tangent, but curious.
No, totally. It's totally valid. Francine Shapiro is the woman who created it. And she said, she's since passed, but her claim was that she was always a research psychologist. So I think she just always had a tendency to ask, like, why is this happening? Why is this happening? So she claims that she was walking down the street thinking about something really distressing. And she noticed that the more she walked, the less distressing the situation was. And she was trying to figure out what are the variables here that could be affecting that. And what she noticed is she was looking around a lot. She was kind of noticing the birds over here. She's noticing what's going on over there. And she started to get curious about the left, right, left, right, left, right. And that is what encouraged her to do some research on the bilateral stimulation with your eyes. And then from there, it then grew with all of the research that went around it, because she started with veterans. And so she got a ton of research to help veterans work through their PTSD. Yeah.
Thank you. I love that.
Yeah. So I thought it could be fun if we have time. What are we thinking time-wise? I thought we could do a little safe, calm place installation. It'll take like 10 minutes.
Yeah, we have time.
Okay. So if you would like, I'm going to encourage everyone to kind of get into a comfortable position. You can either close your eyes or softly gaze at something in front of you. If you want to turn your camera off, you're welcome to do so. If you don't feel comfortable doing any of this, I just invite you to maybe listen. And this is something you can try on your own. And I want you just to take 3 deep breaths in through your nose and out through your mouth. And with every exhale, just kind of settling deeper and deeper into your seat. And with your eyes closed, I want you to place hands on your shoulder. So crossing your arms in front of you, one hand on your right shoulder, the other on your left, and you're just going to hold them there. And while we do this practice, if at any point you notice yourself relaxing or feeling any positive experience, I want you to just slowly tap right to left. You don't have to do it for very long, but just enough that you really notice the tapping. What you're doing here is you're helping your body remember the sensation. If at any moment during this you feel something unpleasant, do not tap. Try to bring the image back to something that makes you feel good, safe, or calm. And as soon as you do, again, start your tapping process. So I invite you to bring to mind the image of a place that you associate with safety or peace or calmness. This could be a place that you've been to, or it could be a place that's completely made up. There are no rules here. And while you're in this place, I want you first to notice what you see. What colors are in this place? What textures do you notice? Are there any people in this place? Are you alone? And as you notice any details that you find to be positive or pleasant, hold them in your mind's eye and tap that in. Now, in this safe, calm place, I want you to notice what you hear. Are there any sounds that you associate with this place? And if there are, and listening to these sounds adds to the safety or the peace of this place, I want you to tap that in. Remember, if anything unpleasant comes up, or maybe this isn't the place you thought it was, that's okay. You can pick a different place. Now I want you to lean into what you might physically feel. So the touch sensation. When you're in this place, can you feel anything? Are you touching anything? And as you do, as you notice that new sensation, if it's pleasant, can you tap that in? And now moving to taste. Noticing if there are any flavors that you associate with this. And as you do, tap that in. If you'd like, I encourage you now to take in all of the senses. And as you do, notice, what does your body feel like? If there are areas of tension, can you try to relax them by immersing yourself in this place? And if you feel relaxed, can you tap that sensation in? So this safe, calm space that you just created for yourself, this is like a baby muscle. So if you found a space that you like, you found a space that brings you a feeling of relaxation, that brings you a feeling of calm, I encourage you to visit this space often and strengthen it with the tapping. Slow tapping. If you're in public and you don't necessarily want anyone to see you tapping your shoulders, you can squeeze your arms. There's a pressure point right by your armpit. So you can cross your arms and just squeeze left, right. And go here often. The more often you go to your place and you allow yourself to feel that calm, you are strengthening the muscle. You are strengthening the ability to regulate and balance yourself out when you need to. So whenever you're ready, I invite you to open your eyes and just take a few moments to take in whatever room you're in. Ground yourself with the colors around you. And that is the safe, calm place installation. That is one example of resourcing in EMDR.
Amanda, I have another question.
Yeah, please.
Okay. So would the goal of that eventually be to where just thinking of this place would make you calm, or the tapping, not necessarily thinking of a place, but just tapping makes you calm?
Oh, great question. The goal is for the idea of the place to help you feel calm. The tapping it's the mechanism we use to help your limbic system install the sensation. Ideally, you will get to the point where you can just think of the place and your body will remember what that feels like.
Okay, that makes sense.
But tapping in general helps a lot of people calm down too.
Yeah. The second we started, I couldn't stop yawning and I was like, oh, means my nervous system is calming down, which is
Oh yeah.
nice.
Oh, you got there, girlfriend. You got
Yeah.
there. Okay.
I have a question. What do you think about like, so when you were inviting us to think of a sense, I'm thinking of taste, but I'm thinking about the taste more than like tasting the taste.
Mhm.
Does that make sense? Is that effective, or are we working towards like tasting the strawberry or the croissant or whatever I was thinking about?
Yeah, I think it's really whatever you're able to do. I think it's less about the actual taste and it's more about the positive association that can come with the taste. So a lot of senses like smell, taste, I mean, it's hard to conjure that up in the moment if you're not actively doing it. But I think we can all conjure up the feeling of tasting something really amazing, right? We can conjure up the feeling of, smelling, for me, freshly baked cookies, right? Like I know that feeling makes me feel good. I may not actually be able to notice what that scent is like in my mind's eye, but I know what it feels like to engage that sense.
That's really helpful. Thank you for clarifying that for me.
Yeah. Thank you for asking. Okay. So the last slide I have, these are just some resources. So there's a really wonderful website called postpartum.net. This is the Postpartum Support International. They have so much information about postpartum depression, postpartum PTSD, really validating stuff. The National Suicide Prevention Lifeline, like I said, with postpartum depression, even with postpartum PTSD, it is not uncommon to have thoughts of suicide, even if you don't have intent, even if you don't have a plan. Sometimes it can just be really validating to have someone to talk to in the moment when you're feeling like you're in crisis. The Huntsman Institute in Salt Lake City also has a great mental health, a perinatal mental health center. So they work with women who are pregnant, women who have just given birth, right? So kind of all through that process, they offer a lot of different therapy, not just for women too, just kind of for the whole family. They offer a lot of services. Okay. That is all I have. Thank you so much, everyone, for listening.
Thank you so much.
Thank you, Amanda. That was really awesome.
Yeah, thank you.
I have another question.